XStat. Instructions for use. RevMedX Incorporated. XStat is a hemostatic device for the control of bleeding from junctional wounds in the groin or axilla, not amenable to tourniquet application in adults and adolescents. XStat is a temporary device for use up to 4 hours until surgical care is acquired. It should only be used for patients at high risk for immediate life-threatening bleeding from hemodynamically significant advanced trauma life support class 3 or 4 hemorrhagic shock, non-compressible junctional wounds, and when definitive care at an emergency care facility cannot be achieved within minutes. XStat is not indicated for use in the thorax, the pleural cavity, the mediastinum, the abdomen, the retroperitoneal space, the sacral space above the inguinal ligament, or tissues above the clavicle. XStat works by applying the small sponges into a wound cavity using a lightweight applicator. XStat contains rapidly expanding cellulose sponges coated with chitosan and individually marked with an X-shaped radiopaque marker. In the wound, the XStat sponges expand and create a barrier to blood flow, present a large surface area for clotting, and provide gentle pressure. The XStat applicator is composed of 3 primary parts: the main body, which holds approximately 92 XStat mini sponges, a telescoping handle, and a bifurcated silicone tip that allows the XStat sponges to exit. XStat is a hemostatic device for the control of bleeding from junctional wounds in the groin or axilla. In narrow, deep wounds, XStat works by expansion of cellulose sponges against the walls of the cavity to apply pressure inside the wound. Prior to using XStat, fully examine the injured patient and assess for signs of bleeding. Arterial bleeding is caused by the laceration of an artery and is the most difficult type of blood loss to control. Arterial hemorrhage is characterized by spurting blood that is bright red in color. Even a small, deep arterial puncture wound can produce significant blood loss. If the wound is not amenable to tourniquet use and is located on the groin or axilla, it is a junctional wound. In the testing of the XStat device, hemorrhage from the groin was created in a swine using a 6mm vascular punch on the femoral artery. The injury bled for 45 seconds prior to device application. The XStat device would be appropriate for use under comparable conditions. If the hemorrhage cannot be identified, or the anatomical location is not a junctional wound, XStat is not the preferred device to achieve hemorrhage control, and alternative treatment should be used, such as other hemostatic dressings or tourniquets. XStat is not indicated for use in the thorax, the pleural cavity, the mediastinum, the abdomen, the retroperitoneal space, the sacral space above the inguinal ligament, or tissues above the clavicle. XStat has not been tested for use in extremity wounds that are amenable to tourniquet application. XStat use in conjunction with tourniquet application has not been assessed for use in extremity wounds that are amenable to tourniquet application. Application procedure: open package and remove applicator. Pull the black handle out and away from the barrel until it stops and locks. Place the tip of the applicator into the wound track as close to the bleeding source as possible. Firmly depress black handle to deploy dressing into the wound. Material should flow freely into the wound. Do not attempt to forcefully eject the material from the applicator. If resistance is met, pull back slightly on the applicator body to create additional packing space. Then continue to depress handle. Use additional applicators as necessary to completely pack the wound with dressing. Do not attempt to remove dressing from wound. Sponges must be removed intraoperatively by surgeon with the capability and equipment for achieving proximal and distal vascular control. Cover the wound with an occlusive or pressure dressing. If available, use an elastic bandage. If bleeding persists, apply manual pressure until bleeding is controlled. Assess patient for peripheral circulation